Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile.
And thanks for joining me for the denture delivery visit. So here we got the denture back from the dental lab. But before we even check it in the mouth, I want to compare it to the old immediate dentures. Here you can see the old immediate denture versus the new denture I just made. I made the old denture 7 years ago, used the same lab, and it's broken. You can see the size difference too, how much smaller the immediate is compared to the new denture. And even the edges of the flange there, you can see how much shorter they are in the immediate. And you can also see the wear and tear on the teeth over the 7 years that he's been wearing it. Okay, so now that you've seen the new denture versus the old immediate denture, there's just a quick look at some of the stuff I use. Basically some pressure indicating paste, acrylic burr, some gauze, and we try it in. Usually like to wet it down, put a little water on there, and then put it in the patient's mouth and see how it fits. Make sure you seat it all the way so it's in the proper location. And the first thing I always do is check the bite on it just to make sure that it's even side to side. I'm not going to do this delivery visit. I don't like doing a lot of adjusting. I want to do the bare minimum of adjusting to get the comfortable, get it usable for the patient. There you can see the spots where it's biting. He told me he feels it more on the right side compared to the left side, so we're going to adjust that. And again, we're just going to pop it in and out a couple times, check with some articulating paper. I like using troll foil because it's got a built-in handle. Adjust it, and we're just going to keep doing that, just adjusting the high spots with my acrylic burr and my slow speed straight handpiece. And I'm going to do that until he tells me it feels comfortable. So a couple more times. In the old days too, we used to actually remount, take a new bite registration and remount the denture on a articulator to adjust the bite outside the mouth. I've kind of stopped doing that, and I just do it by let the patient feel how it is. All right, so we got taken that out. Now that that's done, we're going to dry up the inside because I'm going to use some pressure indicating paste just to head off any high spots, any sore spots before they start. Make sure the inside of the denture is nice and dry. Scoop some of the paste out of the container with a clean Q-tip. Put it in my little plastic dapping dish. There's the pressure indicating paste. And then we just spread that out on the inside of the denture. So this is not a denture adhesive. It's just a white creamy paste that gets spread out. You can leave a very thin layer of it on the inside of the denture. And when you put it back into the person's mouth, and I like to press it in there firmly with my fingers, have the patient bite down on it a few times, move their jaw all around a few times. What happens is the pressure will kind of move it out of the places where it's too tight. So once we get to that point, you'll see where the denture's fitting kind of tight. So you want to get it all around the edges. And usually it's the edges where most people get the sore spots. It's right on that edge. And the reason I don't want to you got to be careful when you're doing this though. You don't want to adjust too much, is because if you adjust it too much off the edge, you could end up losing any suction you have, and the denture's not going to stay in place well. So again, just making sure I got a nice even coating, and then let's pop it in the mouth. Put it in the mouth, press it into place. Now using this is a bit messy. It gets everywhere on the patient, gets everywhere on your gloves. So I'm changing gloves quite frequently and wiping the patient's face too in between. So there I can see one spot right there, and on the other side too. So back right hand side and the back left side. Just a couple places where I know it's going to be a little tight, and that's usually a common area for people to get sore spots way in the back there. So we'll just adjust them, and just very lightly, I'm going to shave it down with my acrylic burr and just remove the tiniest bit of material. This first visit, I'd rather do as little adjusting as possible. So let me put some more pressure indicating paste on those spots, pop it back in the mouth. Basically, if I've done everything as well as I possibly can, all the steps leading up to this moment, the impression, the border molding, bite registration, everything should fit pretty well. I'm happy with how that looks now. So now comes the messy cleanup of it. So for this, I'm just using some non-woven 2x2 gauze just to remove most of the material, just get the bigger pieces out. And then once I get most of it out, I'll spray a little bit of the solvent cleaner onto a couple more pieces of gauze to get that last little bit. And again, messy, gets all over your gloves, gets all over everything. So during this process, I'll change my gloves a couple times so I'm not getting more paste back onto the denture as I'm cleaning it off. And then we're removing anything from the outside. You could technically you could leave it on. It's not going to cause any harm. It's safe. It's non-toxic. But it does make a mess. So we'll clean that all out of there. A little bit of water on the inside, and now put it back in. And this is when we have the patient take a look at it. And I'm going to have a couple photos. Here's some photos that I took of the person smiling. And as you can see, he does not smile much. I told him to close his eyes and smile as big as he possibly can. So this is it. He doesn't show much of his teeth. So these next couple photos, I'm going to help him a little bit with my fingers. So those are my fingers in the photo, part of that. And that's how it looks. And it's the color he likes. He's happy with how he looks. And then now we're going to go, next time I see him is going to be for adjustment visits. And I'm also going to see him next month to start working on his lower partial denture. So that should be some interesting videos as well. Thank you all so much for watching. Really appreciate all the support. If you enjoy this type of content, please leave me some comments down below. Let me know. Please give me a thumbs up as well, and consider subscribing to the channel. If there's any type of specific content you would like to see instead, please let me know down in the comments. All right. Thank you so much.